Botox, or botulinum toxin, is the #1 non-surgical cosmetic procedure in the world. There's 4 commercially available formulations of it in the US. There's Botox, Dysport, Xeomin, and Jeuveau. So whenever you hear me say Botox, I'm not speaking specifically of the brand name, but rather I'm using it instead of saying botulinum toxin. It's sort of like saying Kleenex rather than saying, tissues. So Botox is an FDA-approved medicine that temporarily relaxes or puts to sleep whatever muscle it is injected into. Botox is frequently used to smooth frown lines, like over here, forehead lines, or the lines around the eyes. By relaxing the muscles under the wrinkles, it now becomes harder for you to make the movements that cause the wrinkles in the first place. Your wrinkles are there because over the years you've repeatedly contracted the muscles under the skin by frowning, squinting, and raising your eyebrows. And it's those repeated contractions that have started to break down the skin and make those creases. So Botox doesn't actually treat the skin itself. If the wrinkles are there, even when you're not frowning or smiling, those wrinkles are now actually scars in the skin, and they will not go away after one Botox treatment. So think about a piece of paper that you fold in the same spot over and over again. And even if you then smooth the paper out, the crease will still be visible. However, with repeated Botox treatments, even deep wrinkles will start to improve, because the skin has many, many layers, and the layers in the bottom that are not creased will eventually come all the way up to the surface, and your skin will be smoother. First, we thoroughly clean the areas to be treated with alcohol, so coming to your appointment with no makeup is very helpful. The treatment is basically a few small injections using a tiny needle. Some of the injections will feel like a little pinch, and some injections you won't feel at all. We use the smallest needles on the market, and we use ice cubies to make sure that you're comfortable. You can apply your makeup right after your Botox treatment, and you can return to your daily routine immediately after you leave your appointment. It takes at least 2 weeks to see the full results from the Botox treatments, although you may notice that some muscles start to relax a little bit sooner. At 2 to 2.5 months after your treatment, you'll begin to notice some movement coming back. By 3 months, most patients will notice that full movement of the muscle is back, and that's when they're ready to get retreated. Our goal is to make you look refreshed, not frozen. You will still look like you, just with less noticeable wrinkles. Botox is not a cookie-cutter treatment. Every face is different, and every patient has a different anatomy and different muscle strengths. We personalize the treatment and the dose to your anatomy and your goals. Also, Botox is not an all-or-nothing treatment. The treatment results are dose-dependent, meaning that the higher the Botox dose, the more relaxed the muscle will be, and the longer the muscle will stay relaxed. The lower the dose, the more movement you will have. So if you want to have more movement, we just use a smaller dose. And if you change your mind and you want less movement, I can simply increase your dose. We are typically pretty conservative in our dosage, and so we will give you the smallest amount that we think will give you the results that you want. If it's your first treatment with us, we usually like to see you again in 2 weeks to evaluate the results. And at that time, we can add more Botox if we feel that it is needed. You should consider starting to get Botox whenever your lines start to bother you, or if you're starting to notice that the lines are not going away even when you're not contracting the muscle. Botox works great in reversing fine lines and preventing them from getting deeper. In the upper face, we can treat the frown lines, the forehead lines, and the crow's feet, or the lines around your eyes. If you need it, we can also do a Botox brow lift, in which we selectively relax the muscles that pull the eyebrows down, which then opens up your eyes. We can also correct any asymmetries in the upper face, such as if one brow is higher than the other. And we can also create or adjust your eyebrow arch if you need it. Botox can also be used in the lower face off-label, which means that it is not FDA approved for those areas. Some common areas that we treat are chin puckering or chinulite, which is in this area over here. We can also lift the corners of the mouth if the muscles there are overreactive. We can relax the clenching muscles or the masseters, which will also narrow your lower face. We can relax the lines above the lip, and we can actually flip the upper lip if it disappears when you smile. We can relax the neck bands, which are the bands over here when you grimace, and we can also do the Nefertiti lift, which is a mini lower Botox facelift. Sometimes we may recommend that certain areas not be treated, even though the lines there may bother you. For example, if you have heavy brows and you use your forehead muscles to keep your eyelids up, we may recommend relaxing just the muscles that pull the brows down, like the frown muscles over here, and not treating the forehead muscles in order to give you the most lift. So imagine that you want to frown. Paint the picture for you. So you have your brain, and there are many nerves or signal highways that go from your brain to the frown muscles that you want to contract. There's a nerve ending that's sort of where the highway ends, and there's a space or a ravine between the nerve ending and the frown muscle. The message has to cross this ravine to get to the muscle. There are launching stations at the nerve ending, and there are also docking stations on the surface of the muscle. The brain sends a signal that you want to frown. That signal then travels down to the end of the nerve, and then the launching stations launch a particle called acetylcholine, which then crosses the ravine and docks at the frown muscle. When enough of those particles dock, the muscle will contract. Now, obviously, this happens very quickly. So now let's say we introduce a little bit of Botox to this area. So Botox permanently disables or sort of jams the launch stations at the nerve ending. So now when you want to frown, the signal will go all the way from the brain to the end of that nerve, but because nothing actually gets launched, the signal doesn't reach the muscle. So you want to frown, but nothing happens. Since there are a lot of acetylcholine particles still hanging in that ravine, some of them are still going to be able to dock on the muscle. So it will take several days and up to 2 weeks until that ravine is completely empty of those particles. This is why it takes up to 2 weeks for Botox to kick in. A lot of patients will typically ask me, well, isn't it bad that I'm permanently disabling the launching stations? Well, the answer is, well, not really. Our body is smart, and as soon as it senses that the signal is not getting across, a new nerve ending bud starts growing. It takes about 2.5 to 3 months for that nerve ending to mature and the new launching stations to start getting the message to the muscle. That's why in 2.5 months you can start frowning, and by 3 months you can really frown. The fact is, our body does all of this all the time. Whenever you lift weights or work out, you break down muscle, and with it some of those nerve-muscle connections. And then you build bigger muscle and new nerve-muscle connections. The more you work out, the more efficient and the quicker your body is at this process of creating new nerve buds. That's why Botox doesn't seem to last quite as long in my athletes, and tends to last a little bit longer in the patients who don't work quite as much. Botox is not an all or nothing treatment. Each muscle has many nerves that dock on it. We can disable 50% of the signal so you maintain 50% movement, or 75%, or even 100. Some areas like the frown, we do want to relax completely. But other areas like the forehead, we want to leave with some movement, so we treat those areas very lightly. The Botox doesn't last any longer. 2 things happen. In an area like the frown, people sometimes frown when they don't actually mean to frown, such as when reading or focusing. If you get Botox in that area and are not able to frown for 6 months or a year, you begin to unlearn that behavior, so that even if you stop getting Botox, you will frown only when you really want to and not out of habit. In the body, if you don't use it, you lose it. Imagine a bodybuilder with huge biceps. Now imagine that we put his arm in a cast for 3 months, which is how long Botox typically lasts. When the 3 months are up, we put a new cast on for another 3 months, and then again. Let's say that arm has been in a cast for a year. When we take the cast off, do you think that he'll be able to flex that arm at all? Likely not. The muscles that were not used had atrophied. They are very weak. The same process happens in muscles that we completely relax. If you don't use that muscle at all for an extended period, it will atrophy. It will become weaker. so that even when the Botox wears off and the muscle is again getting the signal to frown, the frown muscles are now too weak to actually frown. This makes it look like the Botox lasts longer. Of note, in muscles that we tend to partially relax, like the muscles in the forehead and the crow's feet, this does not happen as much since you're always still moving that muscle some. Conversely, if someone wants to get rid of their frown lines as quickly as possible, I recommend keeping the area completely relaxed until the lines fully go away.